Yes, good morning and welcome to Health Matter. How on a day? I believe say on a day okay. I believe say on a day all right. My name is Chief Oludodo. He never change. How on a day enjoy on a stay at home. The lockdown. I hope say we dey obey the directives of government. I hope say we dey follow everything we get to do with this COVID-19. I be make Kokora coronavirus. Just on the lighter note, they say na corona drivers. At least we are inside and then we are washing our hands and we are sanitizing. Yes, the essence of this show now to discuss on this pandemic. And as you take note, our guest doctor dey here, we go pieces the whole thing, knowing full well, saying go tell us the current things. I mean, the latest happening as regards COVID-19, not only in Nigeria. His data, his analysis shall cover global results plus situations. So this is the right channel. This is the right place to be for now. Go nowhere, get your pen, get your paper if you are ready to be enlightened and to know more on COVID-19. Welcome to the show, everyone. Doctor, good morning, sir.
Yeah, good morning, Chief.
How you doing, sir?
I'm pleased to be back.
Okay, sir.
Yeah, good morning, viewers at home and around the world. We're happy to be back today on another episode of our regular weekly show, Health Matter on WAP TV. This morning we'll be talking about coronavirus pandemic. That is the talk of the town. It's a topic we started about 3 months ago, and it's difficult to let go of the topic and talk about something else, especially at this time. There is still a lot to be known, a lot to be learned about the scourge. Let me first start this morning by thanking those of us in the front lines, talking about the health workers. A whole number of them, a lot of them have actually paid the supreme price in trying to safeguard and keep us safe. To their families, we want to say, take heart. It's not an easy task, and it's a difficult one, I must point that out. Also at this time, I want to pay homage, a very big thank you to the federal government task force on COVID-19 that are doing a wonderful job. And I like the fact that they've started doing a daily briefing so that everybody can be on the same page. Nigerians can get to know about what is going on, and they can get to know a number of efforts that are being put into this fight against this scourge. I can tell you this morning that as we speak, the number of people that have been affected globally has gone beyond 1 million, has gone beyond 1 million on a global scale. Also in Nigeria, we have a total confirmed cases of 210. Discharged patients are currently 25. Unfortunately, we've seen 4 deaths among these numbers. I also want to say a big thank you to Lagos State team. They are doing a fantastic job. I had an experience yesterday, and I had to put a call to them. I did say last week that one of my patients, though I haven't had any contact with her in the last 2 months,
Okay.
she was exposed to somebody that returned from UK. And as soon as she told me, I told her to do self-isolation. And of course, she went into self-isolation with 2 of her daughters, where they live. And she was updating me regularly on the information she was, on the symptoms she was getting. And about the 13th day, that was yesterday, when the symptoms were becoming overwhelming. Suffice to also say that along the line, the relations prevailed on her, and of course, she visited the hospital between this period. So she called me and then gave symptoms that are in line with case definition that we have in Nigeria as of today. And of course, I asked for her permission. Previously, I sent her some numbers that she should reach out to so that they will always guide her as well. The relevant numbers of the agencies concerned, the NCDC number, the Lagos team number. But this time around, when she reached out to them, they told her that they needed a doctor to call them. And of course, the first call I made, there was somebody at that end to pick the call and quickly attend to the story that I presented. And lo and behold, within a space of 1 to 2 hours, the team arrived in her house. And of course, they took it from there. I haven't gotten a feedback from her, but typically, all the symptoms she had were that of COVID-19. And I want to say that a lot of Nigerians may have complained in time past that they tried to reach these numbers and it was difficult. I can tell you that with the experience I have, there is a change. Those numbers can be easily reached, not like what it used to be before. Also, the numbers we have of affectation in Nigeria at the moment, 210, that may be far below what may be truly obtainable. Why am I saying so? Before I go into what I want to say next, let me appreciate the good work NCDC are doing, as well as the Presidential Task Force on COVID-19. I listened to yesterday's daily briefing, and of course, the Minister of Health said that over 3,000 cases, over 3,000 persons have so far been tested. And of course, when the DG of NCDC took the podium, he actually cleared the air. There is almost about 4,000 persons that have been tested so far in Nigeria. That is a sharp rise from what we talked about last week. And of course, I want to say a big thank you to them for a wonderful job. But this is hardly enough, considering the number of the population of our country. Okay? Now, I also want to say that WHO has advocated for test. And I also want to observe at this time that there are peculiarities from one country to another. The realities on ground and the circumstances are equally different. Nigeria may not be able to test as much as other countries of the world, other developed countries of the world are doing. A number of our European countries have tested over hundreds of thousands. But I know we'll get there someday. Of course, the testing itself has a number of challenges. Even in the countries that you can say they have best of centers or best of healthcare systems, they're still trying and struggling to cope with these emergencies. In the US, for instance, Center of Disease, the CDC have come out to acknowledge that their testing kits that they were previously using, a good number of them were flawed. A good number of them were not correct. They were giving incorrect results. And of course, you and I know what is happening in the US today. They have over 270,000 infected individuals, and their death toll has gone beyond 7,000. At the moment, US appears to be the epicenter of the world. Not to talk about Italy, that has the highest number of deaths so far. And of course, the number of cases affected individuals in that country is going neck to neck with that of Spain, which of course is another European nation. In as much as we want to acknowledge the challenges and the difficulties that testing can actually pose, at the same time, we want to appreciate the good work the Nigerian Center for Disease and Control are doing. We also have some good news that can gladden our hearts. So it's not all gloom and doom. At the moment, we previously had about 5 test centers or testing centers in Nigeria. That has gone up to 8. Lagos State, that appears to be the epicenter, if I can use that word, in Nigeria, currently has 3 independent testing centers in Lagos. Lagos has 3. Apart from the 3 in Lagos, the number of other newly established ones that were recently activated, one was in Ibadan, another one was in Ebonyi State. So in total, we have about 8 testing centers in Nigeria that can work independently. So of course, we are getting there. But of course, it will take time. It's not plug and play. If I can use the phrase from NCDC Director General, Dr. Yekwazo, who has been doing a wonderful job so far. So we expect to get there. I was having a discussion with another colleague of mine earlier in the week, and then we were talking about some states that are yet to witness or experience any positive case in Nigeria. And of course, the doctor pointed out to me, because he's actively involved in the treatment of COVID-19 patients in Lagos, that the truth of the matter is that some of these states are yet to have testing kits. that until they start testing in such states, we can actually not have a true picture of what may be going on there. And of course, I can't but agree with what he said. So we need to actually test to actually have a picture, a true picture. We need to actually test a good number of people in our population to actually have a good picture of the true figures that we have in Nigeria. For instance, South Africa, at the moment, they have over 1,500 infected individuals in that country. And at the same time, they've been able to step up their testing capacity. They now have what they call mobile testing units. And they have over 60 of such that can actually drive to an enclave or to a locality and start testing people. But in Nigeria, we still have to make do with our case definition. Anybody that does not fall into the case definition might not get tested at this time. But with the improvement, with what we are seeing, the DG of our NCDC also said that in the next few weeks, we'll have as many as 13 testing centers in Nigeria. Hopefully, when we get there, we'll be able to test a lot more people. A number of people have actually said that, are you really sure? They are doubtful. Are you really sure we have COVID-19 in Nigeria? How come our numbers are so small? If other countries of the world that have super healthcare systems could be downed by this scourge, what about us? But the truth of the matter is that while we are not seeing those large numbers, may be traceable to the fact that we have not started testing a large chunk of our population. By the time we start doing, it is going to rise. I know that some of the restrictions that have been placed on a number of states are actually, it's actually a difficult time for a number of us, for all Nigerians. We're trying to struggle, we're trying to cope. But it is a necessary price that we all have to pay so that we can save ourselves from getting into an area that will almost feel like having no hope. That is what brings us to the concept of trying to flatten, making efforts to flatten the curve. What is it all about? To flatten the curve is to ensure that the numbers of infected individuals we have are still within manageable limits of what we have in terms of our healthcare system today. If it goes beyond that, it becomes a crisis of a monumental proportion. And I can tell you that at the moment, almost every country of the world are struggling under this scourge. Wealthy nations are crumbling. Best of centers are not making any good headway. Nobody may have time to even assist the next person or the next country. And we have also some good news. The Honorable Minister of Health,
Sagi,
yes, also pointed out that in the next few days, a cargo plane will depart Nigeria to go to China to bring in a lot of needed medical supplies and ventilators. And also, he also pointed out that an 18-man team of Chinese experts that will consist of doctors and nurses and epidemiologists and other health workers are actually going to come back with this special plane, cargo plane that will be leaving Nigeria to China in the next few days. So we're actually reaching out. We're actually trying to improve our capacity. And I want to commend the efforts, the wonderful efforts of the federal government along this line. We're beginning to see the type of united front or battle that Nigeria did as a country when we fought Ebola. And of course, we won. And this one will not be any different. What is coronavirus? Coronavirus is a new strain of coronavirus. A number of coronaviruses have been in existence for decades. A good number of them predominantly affect animals alone, but a few of them have started affecting humans. A number of them that I can mention that affect humans, we remember the SARS of 2002, okay? Severe acute respiratory syndrome of 2002, as well as the MERS, as he rightly pointed out, Middle East respiratory syndrome that came from Saudi Arabian Peninsula in 2012.
Camel.
Of course, it was through animal kingdom. It was through camel. And of course, this one was said to be from bat. It has been officially named COVID-19. Of course, the virus that causes COVID-19 is SARS-CoV-2. And we know some of the symptoms already. The major symptoms include Sorry, I have to constantly adjust my mask, and along the line, we're going to talk about face masks today. Okay, so the major symptoms include, number one, such a person may present with high fever. It's important to point out some of these things so that when we see it around us, in people around us, we can reach out to the relevant government agencies. Such a person will present with fever. Such a person will present with dry cough. And sometimes the third one may be breathing difficulties or shortness of breath. There are other symptoms that are not as strong as the one I've mentioned. The person could also have sore throat. In some percentage of individuals, there could be diarrhea. There could be gastrointestinal symptoms. And of course, if these problems are not tackled on time, it could lead to viral pneumonia, which of course has no cure. And from viral pneumonia, the person can have end organ damage. It could damage the kidneys. It could damage the liver. And of course, death will follow. And that accounts for the reason why we have seen large number of people dying across the globe.
Okay, Doctor.
Go nowhere, we'll go on a short break.
Let's pause you a bit so that we can go on this break. Most definitely, when we are back from the break, we will open the phone lines so that you all can ask questions on COVID-19. I know you're already dialing the numbers, so please go nowhere. A few minutes' time, we'll be back. Thank you, sir.
Thank you very much.
Wet your hands with water. Apply soap, rub your hands palm to palm, and wash the backs of both hands and in between your fingers. Then palm to palm with fingers interlocked. Clasp your hands together and rub, and then clean around the thumbs too. Rub your fingertips in the palms of your hands and finish off with the wrists. Rinse your hands really well with water and dry them thoroughly with a paper towel. Use the towel to turn off the tap. Your hands are now clean.
In the past 2 weeks, the number of cases of COVID-19 outside China has increased 13-fold, and the number of affected countries has tripled. There are now more than 118,000 cases in 114 countries, and 4,291 people have lost their lives. Thousands more are fighting for their lives in hospitals. In the days and weeks ahead, we expect to see the number of cases, the number of deaths, and the number of affected countries climb even higher. WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Pandemic is not a word to use lightly or carelessly. It's a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death. Describing the situation as a pandemic does not change WHO's assessment of the threat posed by the virus. It doesn't change what WHO is doing, and it doesn't change what countries should do. We have never before seen a pandemic sparked by a coronavirus. This is the first pandemic caused by a coronavirus. And we have never before seen a pandemic that can be controlled at the same time. WHO has been in full response mode since we were notified of the first cases, and we have called every day for countries to take urgent and aggressive action. We have rung the alarm bell loud and clear.
Okay, the last clip we saw before the lady demonstrating how to wear the face mask is that of the Director General of World Health Organization, Tedros Adhanom Ghebreyesus. You can see him yourself. That's Tedros Adhanom Ghebreyesus, and it don't make us realize, say, the alarm bell, say they don't ring them. That is no be joke again. So I would let the phone lines be open now so that everybody where they watch us, una go fit call to ask everything where they do your mind. Because as me I did here, 8 questions now I don't line up. I can't just wait for today to come. Vis-a-vis, we still let the doctor, anywhere we have space to tell us about the importance of the use of face masks. So this is my first question, sir. And it's going to be a social medic question. Social medic in the sense that we've been home for some days now, doctor, and we're still going to be home all through next week. All this now to flatten the curve.
Yes.
But sir, after these 14 days of lockdown, I call it social medic because you know our situation. What will happen? Are we still looking forward to more lockdowns, or you feel it is a panacea?
Thank you very much for that question. But quickly, before I go to the question, let me also say a thing or two about the use of face mask. It's important. That's why I ensure that we at least add that short video clip on how people should wear face mask. I must acknowledge that there have been a lot of debates on who should wear face mask. Okay? There have been a lot of debates, a lot of jingles coming from WHO that face mask should be reserved for health workers alone. And of course, they have their reasons. The health workers, people at the front line, are the people who have most need of those face masks. If they are deprived of it, it crumbles all of their efforts that are doing to save our lives. And of course, they have a strong point along that line. But emerging new studies and researches have shown that the use of face masks will actually help in mitigating against further spread of the disease. I will tell you that in a number of countries, the use of face masks is mandatory. A place like China, just recently, a county in China had a new eruption, and of course, they declared a lockdown. We have Rukayat from Kaduna. Good morning, Rukayat.
Good morning, Ruka.
Good morning, Dr.
How are you doing, Rukayat?
We are fine. Good morning. Kaduna is okay this morning.
Okay, go ahead with your question, please.
Okay, my question is, Doctor, is that Nigerians don't have enough hands to handle this issue, that we are inviting doctors from China. And also, you talked about nurses and other things. I think we have enough hands. And they are...
She's talking about help hands that you talked about from China.
Thank you very much. Thank you very much. Now, the truth of the matter is that Nigeria, I agree with you. Her question is it that Nigeria does not have enough hands? The sad truth is that we actually do not have enough hands. That is the sad truth. A good number of our doctors have gone abroad. Of course, that is not debatable. Okay? So the number of doctors that should serve a certain population in Nigeria, in accordance with WHO recommendation, Nigeria has still not met up till now with a specified number of doctors that can serve a particular chunk or number of a population. So we truly do not have enough hands. In terms of the people that are going to be brought in from China, they are experts in this field. Don't forget I said at the beginning that countries of the world that have super health care systems are beginning to crumble under this disease. America, for example, that at the initial stage of this pandemic was asking other countries of the world, at least I remember listening to President Trump asking Iran to call for help, that America will be willing to assist them. The same America today is receiving help from Russia and a number of other countries. So that tells you the whole story. We need these experts to come in and complement what we are doing. And they're coming in from China, and the world can say that these are people who have been able to fight and conquer this, but not completely. I must also point that out. Countries like China has done well. Singapore too has equally done well. So we're bringing experts to complement what our own experts are doing. Okay? Thank you very much. Now, coming back to the first mask before I tackle your question. Now, the debate about who should use face mask has been on. The CDC in America has actually said that all Americans should start wearing face masks. But they called it could be anything. It could be face clothes. Trump actually said that it is not going to be mandatory, that wearing of face masks or face clothes in the U.S. should be optional, that he himself does not wear, but he thinks it will help. Okay? I read it shortly before this presentation. A good number of countries have said that the face mask is needed to help mitigate against this spread.
Sorry, sir. We have Jacob from Rivers. Good morning, Jacob.
Hello, good morning.
You're welcome to Health Matter.
Yes, please, I'm just listening to your program now, and I appreciate what people are saying.
You're welcome.
Thank you very much, sir.
We thank God for what God is doing for us in this country, Nigeria. And I have only one question for the doctor. Okay. And my question will go like this. I know this coronavirus is real, you understand? Because I have somebody that is staying outside the country. And my question is this. But we Nigerians, we are not, as in example, they are not showing us the center and the people in the hospital so that people can believe that this thing is really real. You understand? Because, the way they are just giving us figure, and, you understand, so they are not showing us the center and the site and everything. You understand? They are just making people not to believe, you understand, that this thing is real. But coronavirus is real. It's killing people every second, every 4 seconds. Thank you.
Thank you very much. Thank you very much, sir. Thank you very much, sir. Let me quickly react to what he has said. In medicine, there's what we refer to as patient consent. Patient consent. It is important and it is very, very well respected in the medical field. If a patient says he or she does not want to make her problem public, you cannot, it's forbidden for a doctor to go against such a decision, a patient decision. I do know you have a point by saying that some of these things are not being shown to us, that some people are still doubting, are we sure we truly have this in Nigeria? I want to believe that is the reason why a good number of our known individuals have come out to say, of course we know former Vice President Atiku Abubakar came out to say that his son has it. A number of governors have also come out to say that they contracted the infection. And so we know a lot of Nigerians have come out to say, yes, we have this infection, but we are doing what government said, what the relevant agencies have said we should do. And it is the same all over the world. In the US, for instance, those stars that are coming out to talk about, I don't think I've seen any video clip of US showing patients in a hospital or on ventilators. You understand? Yes, sometimes they could show video clip and oftentimes they could cover the faces of such individuals. It is to prevent their privacy. I've also seen 1 or 2 Nigerians that survived have come out to talk about their ordeal. Okay, so it is difficult for government to actually allow that to be shown to the public. Okay, don't forget that in this case that was when he was discharged, he posed for pictures with some other health officials and the Commissioner of Health for Lagos State, but his face was covered. It was blurred. Yes, it was covered so that his identity cannot be known, except the patient himself chooses to actually
give consent.
Of course, voice out and then say that he actually had this disease and he has been cured. That is my answer along that line. Okay, so still on the use of face masks, I said that CDC in the US have said that all Americans should start putting on face masks or face cloths when they are outside their homes. And I've said it is mandatory in some nations of the world. And we also saw in the news that Nigerian authorities are considering.
Sorry, sir, we have Grace from Rivers. Good morning, Grace.
Good morning, sir.
How are you doing, Grace?
I'm fine.
You're welcome to Health Matter. The doctor is here.
Okay, I'm watching your program right now.
Thank you very much.
So, good morning, sir.
Good morning, my sister.
How is everything?
Fine, thank you. We're pleased to have you.
Okay, dear. So, I want to ask a question. The symptoms you people talked about, is what has always been, as in, is a normal, like we normally have headache, fever, cough, whatever, fever and all that. So I don't understand, because like some days ago, my little baby had a very high fever and I bought him drugs and it was okay. So
So coming to think about it, the science of the virus people are talking about, I don't really understand. It's what has been happening before. So my question now is, at what length do we know that it's coronavirus? That's my question.
Thank you, Grace.
Thank you very much for that wonderful question. It's a bit medical, and I like the question. Now, let me answer the question by pointing out that the upgraded case definition for Nigeria that will actually warrant the relevant government agencies to come and conduct a test for COVID-19 for such individuals. They actually said, in the midst of these symptoms, if a patient is presenting with some of these symptoms, with a significant history of contact from maybe somebody who returned from abroad, with no alternative diagnosis, without any alternative diagnosis, in a situation where somebody, of course, hospitals have been treating people who are presenting with these symptoms. Hospitals have not shut down. People will still have malaria, people will still have typhoid, and of course get cured. Okay? But what they're saying is that if the diagnosis remains unknown, okay, one should have a high index of suspicion, especially now that we are beginning to see community transmission. Okay, because I also would like to point out that the Director General of NCDC actually said that they are in contact with 71% of 6,700, which translates to 6,700 people that they've been talking with, okay, that have been exposed to individuals that probably have this. And that on its own is a large number. So you can actually tell who has it and who does not have it. Apart from talking about people that are symptomatic, we also have a challenge on our hands, the so-called silent carriers or asymptomatic carriers. These are a group of people that can transmit the infection even without showing any symptoms. And of course, that number of asymptomatic carriers are beginning to grow. We have James from Nasarawa. James, good morning.
Good morning, James.
Good morning, sir.
How are you doing?
Good morning.
Yeah, go ahead with your question, James.
Okay. My question is the mandating the using of this face mask.
Okay.
Is it possible that they put a law that somebody that you must use it, if not, you can't go out?
Thank you very much. It's difficult to say that for now, but all I can say, as I said, I tried to point out before, is that the Nigerian authorities are considering seriously calling for a mass use of face mask. They've done that already in the US because the models of responses from other countries that have done successfully well in the fight against COVID-19 showed that those countries employed mass use of face mask. And that is why we are laying emphasis this morning on how to correctly use the face mask. Number one is that the face mask has two sides. One is usually the colored side, the bluish, the greenish colored side, and the white surface. Now, if you want to wear a face mask, there is only one way to wear a face mask. The white surface must be inside, must be touching your nose, your mouth, must be covering your nose and your mouth. Okay, the colored side should be outside. And before you even touch the face mask, you need to wash your hand. Because if you have picked up the pathogen from a hard surface and you're trying to wear a face mask, you may have contaminated the face mask that you're trying to wear. So first you need to wash your hand. And after washing your hand, you need to position it the right way. And after doing that, by the time you fix it on your nose, there is something that looks like a metal on the nose bridge that you need to compress. So it gives a form of grip on your nose. It is demonstrated in before us, okay? And then you cover properly to ensure that it covers both your nose and your mouth. Why is it important? The newer studies that are coming out have shown that the disease can be transmitted by people who are not showing any symptoms, just by talking, by sneezing, coughing. Some studies say even breathing, okay? So by the time you use a face mask or a face cloth, whichever one you can lay hands on, you're able to prevent this from happening. I might be an asymptomatic carrier, and nobody might know. Okay, so as I'm talking now, I can tell you that droplets of spit are leaving, salivas are coming out of my mouth, but this face mask is blocking them. Okay, so in America, they are saying you can use face clothes, some can be homemade, but we are also looking at possibility of Nigerian textile industry going into the production of this face mask, so that we can. It is not a complicated technology. It's something that you can easily do if you have the right. Yes, if you have the right materials. Okay, so it's important we point out that. Keep in mind that I said that WHO position is still that face mask should be reserved only for health workers. But I know that in no distant time they will also review such a position, in line with the emerging newer studies that are coming out at the moment.
Okay, doctor, let's move on.
So your question again, the first one.
Okay, I'm talking about what's our fate on the social medical issue that has to do with we've stayed 14 days. We are going to stay 14 days at home. Do you envisage that we are...
Now, the essence of asking us to be on a lockdown, I will also implore Nigerians, I will beg of us, because in Lagos State, where, of course, I live, I discovered that the restriction is usually tighter in the morning hours and the afternoon. But when it is 7 p.m., everybody appears to be on the road again.
Danfo is back on the road.
The kekes are back. A number of buses, you could also see them. This is not right. This is not right. That's where responsibility comes in. We need to show some responsibilities as the led, as Nigerians, to complement the effort of what our leaders are doing. Okay? Kizito from Ondo. Kizito, good morning.
Okay, good morning, Kizito.
Yeah, good morning.
How are you doing, sir?
I'm fine.
The doctor is here. Go ahead with your question, please.
Okay. Good morning, Dr. Bat.
Good morning. Good morning, sir.
How are you today?
I'm fine, thank you.
Thank you so much for all you have been doing in updating us on this pandemic virus.
Thank you so much.
However, I have a question. My question is this. Recently, the social media has been awash with different stories in relationship with this virus concerning the 5G technology. So I want to ask, is there any way that technology can be used to spread this disease?
Thank you very much. Thank you very much. I must say that I was actually expecting someone to...
Kizito. It's part of the question I have here. The 5G, we saw it over the weekend. It was everywhere.
Yeah, Kizito is a classmate of mine. Thank you very much. Okay, so let me say this. I've seen video clips. I've also seen audios, okay, trying to link up COVID-19, okay, with the recent launch of 5G.
Radioactivity.
Yeah. Now, from a medical perspective, I've tried to do a lot of research along that line, okay? Granted that those radioactive waves may have some deleterious or some health implications, I don't think, and I've not read, a number of authorities have actually come out to debunk such claim that there is no truth in that, okay? The coronavirus itself, as we know, came from animal kingdom, okay? So it can't possibly have come from 5G. 5G may have its own health disadvantages, which of course I can't talk more on that because if any, I don't have information on that. But what I do have information is on the fact that the 5G, the claim that coronavirus emanated from or has something to do with 5G has been scientifically debunked. So it is not true. It is fallacious. The statement, that link is not true. Okay? Coronavirus, as we know, came from animal kingdom. I do know, too, that there's existence of biowarfare. Okay? Yeah. We know about that. We have seen anthrax some years ago, some decades ago, that were being posted to people through mails and all whatnot. They exist, okay, but not related to 5G.
Dr. Bat, what's your take on vitamin C and plenty of water? We've heard the NCDC boss, Dr. Chikwe Iyekwazu, talked about this. What's your own take? Do you feel it's really a good cure? Oh, not cure this time around, but sustainer?
Vitamin C. Let me also say this. Before I answer your question on vitamin C, the WHO on March 20th, okay, that was last month.
This year, Abby?
This year, March 20th this year, initiated a mega trial for a number of drugs. There are about 4 drugs in that category. They call those mega trials Solidarity, okay? Vitamin C is actually not one of those drugs that are undergoing trial. The drugs that are undergoing trial is Remdesivir, a drug that came out during the time of Ebola is an experimental drug at the moment. Hydroxychloroquine, as well as chloroquine phosphate, are other drugs that are undergoing trials. Also, along that line, the FDA has given an emergency approval for the use of hydroxychloroquine and chloroquine phosphate in the treatment of patients with COVID-19.
They've given the approval.
Emergency approval. Okay. Emergency approval, though. Okay. So doctors are now using those drugs. But at the same time, clinical trials are ongoing with these drugs. So we don't have anything definite at the moment, other than that a number of centers have actually come to say that they've tried these drugs and they came out with good results or some encouraging results. In the coming months and weeks, we may actually see definite information along this line. Apart from the three I mentioned, there's also some HIV drugs that are equally among the drugs that are being used for these trials. Now, coming to vitamin C that you mentioned, vitamin C on its own actually helps the human. It actually helps in our maintaining our immune system. Okay, it is an antioxidant. It is a water-soluble vitamin, which means that even if you take plenty of it, the body system can dissolve, and of course, it can come out through urine. The worst-case scenario is that it will give you diarrhea. Okay, I'm not advising people to take plenty of it. The required daily dose for vitamin C is 90 milligrams. Okay, in some situations, a pregnant woman may require more. Okay, but it is an antioxidant that helps to mop up free radicals in the human system. Doctor, it helps to maintain our immunity.
Sorry, sir, if we are to do the counting, the yellow one would take, like how many should an individual take?
3 times daily.
3
times. It can help you with your immunity, but it hasn't. Granted that I read that some Chinese authorities actually use IV vitamin C on high doses in the treatment of people with COVID-19, and they got good results, especially when it comes with improving their lung function. I must also point that out.
Okay, before we go, doctor, quickly, the issue of chloroquine that was approved, is it advisable as a residential prevention, or we should never touch it till the doctor says so?
Nobody should go on making use of chloroquine except if it is by doctor's prescription.
Okay.